Hello, good afternoon. My name is Dr. Trey Ufondu of Snowspirations Global Health Solutions. How are you? Thank you and welcome to our weekend open clinic. Today we're going to talk about painful period, painful menstruation, which medically is called dysmenorrhea. Dysmenorrhea. So it's possible as a woman, if you're still within your reproductive phase of life, you notice that whenever you're having your period, you experience pain. For some people, this pain has been constant. This pain has characterized just your normal bleeding. We've always experienced painful bleeding. It's your standard. So if you're in this category, no worries. It's just part of your cycle. So please, when you join, let's know who you are. Let's know where you're located. We're going to spend about 30 minutes. The first 15 minutes will be my teaching. Then the second 15 minutes, you will have opportunity to ask your questions. This topic is very important. So long as you've not gone into menopause, you are expected to bleed every month. So menstruation period or, whatever nomenclature you use in where you live, it's something you need to pay attention to. It might be a sign of some underlying medical problems. It might be a sign to dig in further to know what's going on. So I'm going to start. Once you join, settle in, announce your name, announce your location. Immediately after this clinic, I will host another clinic in Facebook. If today is the first day attending the clinic in YouTube, thank you so much. Make sure you subscribe. After this, in this particular channel, click on the subscription button, click on like, set your notifications so that anytime I show up, you will participate in real time. Weekends, it's normally 12 p.m. Eastern Time, US, or 6 p.m. Nigerian. So today is a little bit outside the normal time I normally show up. Then on Tuesdays, I also show up 6:30 p.m. Eastern Time, US, which is 12:30 a.m. in Nigeria. So let's talk about painful bleeding. Now, the fact you're bleeding by itself is a welcome development. What leads to bleeding? You see, it's expected that every month you will become pregnant. The body of a woman is structured to the extent that every month there will be availability of eggs, which will be released from your ovaries. When these eggs are released, it's expected that the sperm will come in and fertilize this egg, then pregnancy will start developing in the womb. Of course, that's not ideal. We cannot all become pregnant monthly. We can only become pregnant when we want to become pregnant and when we are of age and when we are matured enough. Any woman can become pregnant before her maturity. Matter of fact, lately, as early as 9 years, a lady can become pregnant because once you are able to bleed, it's a sign that you're matured reproductive wise and you can become pregnant. Now, if that fertilized egg, everything goes okay, then pregnancy will go okay, then you will not bleed. But if there is no fertilization, the cover of the womb, which is called the endometrium, will disintegrate. So during the disintegration of the cover of the womb, there is an important substance called prostaglandin. I want everybody to pay attention to prostaglandin. The reason why you experience pain to some degree during your bleeding is because of release of prostaglandin. The reason why you have this pain is because the prostaglandin will go to the womb and tell the womb to contract. So the pain you're having when you're bleeding is because the cover of your womb will disintegrate because pregnancy failed to happen. Then when that happens, the increase in prostaglandin will lead to contraction. So your womb will start contracting to expel the contents inside your womb out. Now, The mechanism that prevents pain in the body is availability of oxygen. When the womb is contracting, the blood vessels will be stretched. When the blood vessels are stretched, it will deprive some blood vessels oxygen. When you don't have oxygen when the womb is contracting, you will start having pain. Now, women have different pain thresholds. So there are some women that will have dysmenorrhea, which is painful period or painful menses, to the extent that for the 2, 3, 4, 5, 6, 7 days they will have this, they will not have any activity of daily living. There are some women that when they are bleeding, they won't go to work. They can't go out. It's that bad. Now, coupled with this dysmenorrhea, some other women will also experience heavy bleeding and bleeding in clot. If this has been your case from day one, when you started having your bleeding, then somehow it's part of your menstrual cycle. But if you notice that this is a new development, then it's possible that something is going on inside of you. There are principally two types of dysmenorrhea or two types of painful period or painful menses. You can have primary dysmenorrhea or secondary dysmenorrhea. When you have primary dysmenorrhea, it means it's the natural way of the pain that normally happens when there is failure of pregnancy and the contents of your body are being expelled outside. So it's something that you expect to have monthly. So it's your normal. There is nothing abnormal about it. Now, for the secondary dysmenorrhea is subject to some gynecological problems inside your body. So there are a couple of problems you will develop, and it will present with pain when period is coming. Number one is a condition we call endometriosis. When you have endometriosis, the endometrial cells that should be limited in the cover of your womb will be seen elsewhere. Some will go to the ovaries, some will go to the tubes, some will go to the abdomen. Now, the problem is anywhere you have endometrial cells, when your bleeding period comes, those cells will start bleeding. Now, because you don't have any avenue for the blood to escape from the tube or the ovaries or the abdomen, when you begin to have those pain, there will not be any avenue for them to escape, and you will begin to have pain. Those period and blood collection there will begin to damage the structures there. So endometrial cells in the ovaries will lead to endometrioma, affecting the function of the ovaries, leading to likely infertility. Now, some women can also have fibroid. Majority of women of Black origin will have fibroid. Fibroid is a big culprit in secondary dysmenorrhea. Some women will have pelvic inflammatory disease. When you have pelvic inflammatory disease, it means you were exposed to either chlamydia or gonorrhea. Over time, they form some complexes in your reproductive system to the extent of leading to pain. So these are these natural commoner things which can lead to secondary dysmenorrhea. Now, some women in cause of this dysmenorrhea will also notice fatigue. They will also notice vomiting. They will also notice irritability. They will also notice low mood, because when you are doing all this, the reason why you might be having fatigue is because you're losing a lot of blood. When you're losing a lot of blood, you tend to be weak. Now, the reason why you might be having signs of trying to vomit and actually vomiting is because it can disrupt the whole pathway in your body. So dysmenorrhea might be normal or it might be abnormal, depending on the likely reasons why you have this. Now, for some women, majority of women will begin to notice some ease as they are getting older. There are some women that prior to becoming pregnant, they will have this very bad dysmenorrhea, but over time, when they begin to have babies, the dysmenorrhea will reduce or stop completely. Now, some women can have the opposite. There are some women that prior to having babies, you wouldn't even know they are bleeding. Then subsequently after having babies, they begin to experience painful period. So it depends on your constitutional factor. But the point I'm making today is, as a woman, this is the rite of passage you will experience every month until you go into menopause. When you go into menopause, you will no longer bleed because there are no eggs that will be released. And after the eggs is not fertilized, you will bleed. So menopause is more like a retirement. So all the problems you're having as a woman that want to have a baby, the moment you enter menopause, you will no longer bleed. You will no longer be having dysmenorrhea. Your life will begin to change. So you're more like getting ready to enter menopause, to enter for that part of life. Now, remember, when you get into menopause, you can no longer be able to have your own baby because there is no availability of eggs. There are other things that can happen to your body when you go into menopause. Dry vagina, hot flushes, low libido, mood swings, night sweats, they are all signs of menopause. But it's not a disease condition. Just like menses, it's not a disease. Bleeding is not a disease. Pregnancy is not a disease. Now, how can we manage this dysmenorrhea? Majority of people can quickly go and pop anti-pain medications. The commoner recommended over-the-counter medication is type of drug we call NSAIDs. Example is your ibuprofen, your Fertility, and all that. The reason why we prefer this type of medication is because they are anti-prostaglandins. So they prevent the increase in the prostaglandin that would lead to contraction in your womb. So the popular choice of drugs you can buy over the counter and use to have remedies if you are having dysmenorrhea is in the class of NSAIDs, non-steroidal anti-inflammatory drugs. Example is your ibuprofen, your Fertility, your diclofenac. They are very effective. But please be careful. The best way naturally to manage your pain, because your pain is now going to be part of you until you enter menopause. The less pain medications you can take, the better. What you can do when your period is about to come, prepare your body. Have some heat pads here and there. Make sure you're in a comfortable place. Avoid spicy food. Exercise. For some reason, women that exercise and stay active, they tend to have less dysmenorrhea compared to women that do not exercise. Watch your body weight. Avoid sugary things. Avoid high calorific food. Avoid pepperish things. The reason is because when you're avoiding all this and you're exercising, you are distressing. So I will personally not want you to be taking painkillers incessantly, because I tell you what, for any drug you are taking in your body, you're paying for it. All painkillers can damage things in your body. Your common acetaminophen, which is your Panadol or your paracetamol, they are hepatotoxic. Over time, if you begin to consume them on a long-term basis, they can damage your liver. Of course, your ibuprofen and other NSAIDs can complicate your pelvic ulcer disease. They can actually induce ulcer by themselves. So the point I'm trying to make is to try as much as possible to avoid depending on painkillers when you have pain during your period. But dysmenorrhea is something you can't wish anybody. So if your class of bleeding, it's really extreme. Some women can bleed, some women can have this pain within 12 to 72 hours. Of course, pain is not a comfortable thing. So if you noticed that this has really increased over time, then it's possible it's secondary dysmenorrhea. You need to ring your doctor. If you notice you're having a fainting attack, if you notice you're seeing double within this period, if you notice you're disoriented, it's possible there are other complications going on in your body. Ring your doctor and go in for thorough assessment. When you get to your doctor, there are a couple of things we're going to do. We're going to ask you about your cycle. A normal woman is supposed to have a 21 to 35-day cycle, normal. A normal woman is supposed to bleed at least up to 2 days, not more than 7 days. Now, we're going to ask you the frequency, we're going to ask you the pattern, then we're going to examine your body. We're going to conduct what we call pelvic examination. During pelvic examination, there's an instrument we call speculum. We introduce this speculum to the vagina, and it will give us a clearer view of your vagina, a clearer view of your cervix, and a better view of your womb to see if we can discover things that might be causing this. So women that have recurrent, painful dysmenorrhea that has defied all the odds, when you present to the hospital, we are going to conduct extensive pelvic examination that will give us an idea of what's going on. So your management of dysmenorrhea is based on your own unique reason why you're having this dysmenorrhea. So if your dysmenorrhea is because of fibroid, what's the best management? We remove that fibroid. If it's significantly big and if it's causing you a lot of problems, we remove that. If your problem of dysmenorrhea is because of endometriosis, then we treat you clinically. just in that line. If your problem is pelvic inflammatory disease, then we'll treat you appropriately. So the management of painful bleeding, of painful menses, of dysmenorrhea is based on the reason why it was happening in the first place. If your own is primary dysmenorrhea, you've had it all your life, by now you should have had a balance. Personally, don't go gulping pain medications anytime you have pain. That's not good. Your body can actually come to a point where your body might no longer respond to anti-pain because your body is now resistant and used to those painkillers. Only use painkillers if you cannot handle your pain with your higher centers. Okay? That's my presentation. I'm going to open the clinic now, and we have a full house. The whole admin is in attendance. So please start asking your questions. Remember, we have a big event coming up on the 26th. We are actually ready. The flyers are ready today. Mega multiple pregnancy super masterclass. I want you to take the words seriously. The phrases is going to be mega. Why? We have two solid subject matter specialists, fertility experts. Our collaborating fertility expert in Lagos is going to be there. Our collaborating fertility expert in Abuja is going to be there live. I will be there. Dr. Ndiche will be there. So it's going to be a group of 4 solid, experienced, rugged, intelligent doctors sharing their current knowledge about how you can succeed in having multiple pregnancy. Multiple pregnancy is the ability to have more than one baby at a sitting. The commonest type of multiple pregnancy is the twins, followed by triplets, then quadruplets. So if you are tired of running up and down, you can actually complete your family in one sweep. You have 4 babies and that's the end of the discussion. You have 2 babies and that's the end of the discussion. Or 3 babies and that's the end of the discussion. So I encourage you to keep the 26th of this month open. But right now, please start asking your questions. Because you don't have multiple in the clinic, I'm going to limit the time for this particular presentation to 20 minutes. We have just 3 minutes to ask our questions. So please feel free to ask your questions immediately before we go. Dr. Ndiche is also in the clinic. So ask your questions before we transition to Facebook. Don't miss the Facebook presentation immediately after this. We have more audience. We have more people. You will have more opportunity to interact and get feedbacks to your question. Please ask your questions. You have just less than 2 minutes to do that. Sarah Owadai, thank you for coming. Vine, thank you for coming. The rest are already part of the group. So ask your questions. Feel free to do that before we go. Okay, so I can see we are all good. It's a very straightforward, simple, explanatory discussion. Okay, thanks, Doc. Is there any lifestyle that can help minimize pain? Yes. Exercise. When you are exercising, you are releasing endorphins. You are releasing anti-stress substances. So the more you're stressing, the more your pain is going to be a lot. So when you release your endorphins, when you sweat, you feel less pain. Of course, what you eat, you need to eat correctly. You need to eat your fruits and vegetables in lieu of fried things. So if you're a candidate for dysmenorrhea, don't eat all those fried things. Don't eat all those highly spiced food because they're going to make it worse. So definitely put in a lot of rest. So resting is important. Sleeping is important. Drinking a lot of water is important. Avoiding smoking, avoiding alcohol, exercising, sleeping. All the things I mentioned will help with your pain. Now, if you live in a very high bustling and hustling environment, whenever you're having your dysmenorrhea, change your environment, dim the room, no noise, take some warm bath, use some heat pads. The more reserved you are, the more quieter your environment is, the better you're going to have relief. So you have to switch to healthy lifestyle to get relief. I love that question from Kenneth. So guys, it looks like that's the only question we're going to take from the audience today. So thank you so much. And please quickly join me to our Facebook where I'm going to start another clinic immediately. Thank you and enjoy the rest of your evening. And I'll see you guys again next week. Bye-bye for now. God bless.